Hi guys, this is Dr. Pangelinan, and in this lecture I'm going to talk about intellectual disabilities and Down syndrome, which is one type of disability that falls under the umbrella term intellectual disabilities. At the end of this lecture, students will understand the types and characteristics of intellectual disability, including Down syndrome. You'll know how to use the appropriate terms to talk about and to interact with people with intellectual disability. And you'll become knowledgeable about the supports that are used to teach those with intellectual disabilities and Down syndrome based on our experience working with children and adults with ID and DS. The American Association of Intellectual Disabilities defines intellectual disability, or ID, as a disability characterized by significant limitations in both intellectual functioning and adaptive behaviors as expressed in the areas of conceptual, social, and practical adaptive skills. This type of disability originates before the age of 18. On Canvas, you'll find a YouTube video from Special Olympics that talks a little bit more about ID. You will need to watch this video in order to do well on your quiz for this week. There are certain characteristics or criteria that need to be met to get a diagnosis of intellectual disability, and each criteria impacts a different aspect of intellectual functioning. For example, problems with learning, reasoning, problem solving can coexist with potential strengths. So you can have an intellectual disability, but have a strength in math. You could have an intellectual disability, but have strengths in motor skills. So there's a very, very large variety of characteristics for those with intellectual disabilities, and you'll see this when we watch the videos from the Special Olympics Young Athletes program. To receive a diagnosis of intellectual disability, you have to undergo formal intelligence testing and score below 70 to 75. Some IQ tests require less verbal ability, so you can have someone that is nonverbal or has no expressive language, and you can still test them to determine their level of intellectual functioning. You also have to have difficulties in adaptive behaviors that affect your ability to participate in activities of daily living. Adaptive behaviors includes conceptual skills, which are skills like language, reading, writing, money and math concepts, and self-direction. For example, I know how to schedule and plan my day and can execute the schedule of things that I need to do. Social skills includes interpersonal skills, making friends, showing a sense of responsibility, and sometimes includes self-esteem. The term naivete refers to a sense of innocence or lack of understanding of people's actions and their motivations. Naivete can leave people with intellectual disability open to victimization, including sexual victimization, which is a really big problem with individuals with intellectual disabilities. Social skills also includes obeying very strictly rules or laws or not understanding those rules or laws. Lastly, practical skills include activities of daily living like putting dishes away or making the bed. It can also include more complicated routines involved in activities of daily living. Practical skills also include occupational skills like how to behave in a classroom if you're in school, how to ride a bike or drive a car, or responsibilities if the individual has a job. Practical skills also include the ability to maintain one's health, including how to get help, managing your own health care like taking pills or eating a healthy diet. Practical skills also include maintaining safety, like knowing to turn off the stove, locking doors, or crossing streets only when you know it's safe to cross. Again, the last criteria for the diagnosis is that the individual must be diagnosed before the age of 18. Often diagnosis happens when the person is an infant or young child so that they can receive early intervention services, which may include access to physical, occupational, or speech therapy. Early intervention usually takes place from birth to age 3. Certain types of intellectual disabilities, especially those with known genetic basis such as Down syndrome, may get access to early intervention even before formal IQ testing or formal intellectual disability diagnosis, because of the high likelihood that the child will eventually exhibit problems like intellectual or adaptive function. There are many causes of intellectual disability. For example, different genetic disorders such as Down syndrome and Fragile X may cause intellectual disability. Adverse prenatal or early environmental factors like exposure to maternal drug or alcohol use, lead poisoning, incredibly stressful life events like death of a family member, or maternal infections while pregnant may lead to ID. Prematurity, meaning that if you were born before 40 weeks of pregnancy, may also result in your brain not fully developing. This can also lead to intellectual disability. Typically, the earlier the infant is born, the more likely they are to have an intellectual disability. Significant neonatal infections, both in utero and during postnatal development, can also lead to intellectual disabilities. Different types of significant head trauma or head injuries, that includes examples of child abuse, falls, and car accidents, can also lead to intellectual disability. Lastly, any situation in which there's a significant oxygen deprivation to the brain, one example is near drowning, in which deprivation of oxygen to the brain causes those brain cells to die, can also lead to intellectual problems. We will spend a little bit more time talking about Down syndrome, which is a developmental disability that commonly causes intellectual disability. Down syndrome is caused by a specific genetic mutation in which a full or partial copy of chromosome 21 is present. This is called a trisomy because there are 3 full or partial copies of chromosome 21 rather than 2. Down syndrome affects 1 in 700 babies. It's very common to get prenatal genetic testing in order to identify Down syndrome or other trisomies that affect other chromosomes and may cause developmental disabilities if the mother has an advanced maternal age, which means pregnant after the age of 35. The characteristics of Down syndrome include intellectual disability as one of the hallmark features, but also differences in the hands, feet, and facial characteristics. There may also be too much laxity or loose ligaments in the atlanto-occipital joint at the intersection of the first and second cervical vertebra. This happens in about 2% of children with Down syndrome, but can potentially cause the bones to be less stable and cause an injury to the spinal cord. Atlanto-occipital instability is also associated with pain, tingling, numbness, or weakness in the head, back, and upper body when the head is put in different positions, like looking up or looking down too far. Individuals with Down syndrome also have ligamental or joint laxity. This means that they're really flexible, but also that their joints are unstable. Low muscle tone or hypotonia is when the muscles don't have the necessary amount of tension to maintain basic positions. The muscles seem floppy or limp. This is also seen as weak core muscles, which result in poor posture. Low tone may also increase fatigue in people with Down syndrome. Some individuals with Down syndrome have congenital heart defects. Often these heart defects may be corrected with surgery in infancy. For all of these different reasons, people with Down syndrome also often have coordination difficulties. They have trouble coordinating their upper and lower body, or 2 hands together, or 2 feet to do different types of motor skills and maintain balance during complicated tasks. There's also a tendency for people with Down syndrome to have greater fat mass, but this and coordination difficulties may be reduced when people with Down syndrome have access to high-quality, adapted physical activity and sport programs and maintain a healthy diet. Vision and hearing problems, including an increased tendency to get ear infections, which can also contribute to hearing issues, is also common in people with Down syndrome. Although all of these are common signs and symptoms of Down syndrome, not everyone with Down syndrome has these issues. The person on the right is Chris Nikic. He is the first Ironman competitor that has Down syndrome. I posted a video on Canvas to a link of his acceptance speech for the Jimmy V Award for the ESPYs. He's very funny, and it's amazing that he's been able to complete an Ironman. Okay, so now that you know more about people with intellectual disability and Down syndrome, let's talk a little bit more about the behavioral supports to help people with intellectual disability and Down syndrome participate in physical activities and sports. These supports are based on special education best practices and are commonly used in adapted PE and adapted sport programs like Special Olympics. The first type of behavioral support are visual supports. These include the use of images with simple instructions. These are also called task cards, and you'll see examples of task cards in the Special Olympics Young Athletes program, as well as in my next lecture about autism. The second type of behavioral support are verbal supports. Verbal supports are simple cues that can be used to remind a person about key aspects of the skill. For example, we could say star jumps for jumping jacks because the wide position of a jumping jack looks like a star. Or you could say 2 feet to remind the person to keep their feet together when doing bunny hops. Verbal supports help to reduce the memory demand, especially if the skill has a lot of components or instructions. Like for the standing long jump, you need to swing your arms back while you bend your knees. Then you need to swing your arms forward while you straighten your knees. And then when you land, you need to swing your arms back while you bend your knees for balance. And you need to keep your 2 feet together the whole time. This is a lot of verbal instructions and can lead to confusion. Third type of support is physical assistance. This could be holding a person's hand while they do a motor skill that requires balance, like jumping or walking on a balance beam. This could also take the form of a demonstration in which you move the person's body the way you want them to move. For example, if the person doesn't use their arms to create momentum while jumping, you could hold their hands and exaggerate the arm swing. This process is called hand-over-hand demonstration or instruction because you're literally holding their hands during the activity. Physical demonstrations can enable the person to see what they're supposed to do, and that helps them to manage the number of instructions and the goals of the task, as well as understand the coordination demands of the skill. The combination of physical demonstration and good verbal cues makes it much easier to learn and perform different skills. The last type of behavioral support is adjusting the task. This could be an adjustment in the amount of time you give to a participant to complete a task, the amount of strength that's necessary to complete a task, or the degree of coordination that's necessary to complete the task. Making task modifications doesn't always mean that we're making the task simpler. It can also mean that we're adjusting the task to best match the ability of that person. So if the person is very advanced, then we might make the task more difficult, like raising the height of a basketball hoop, making a target smaller, or increasing the distance they need to run. Okay, the last topic I want to discuss is proper terminology when talking about a person with intellectual disability or Down syndrome. The preferred terminology uses person-first language. What I mean by that is you put the person before the disability. So, a child with intellectual disability or an adult with Down syndrome, not an intellectually disabled child or a Down syndrome adult. We also don't use the term special needs, and we definitely don't call a participant a special needs kid or a special needs adult. Lastly, and this should go without saying, we will never use the R word. I have posted a video on Canvas. It talks about why the R word is so offensive and should never be used, even when joking. Okay, in order for you to do well on your first quiz on intellectual disabilities and Down syndrome, please make sure to watch all of the videos posted under week 2. If you have any questions, you can email me and we can set up a time to meet. Good luck.